Ready? It's condenser mic, so here you'll pick it up fine.
Okay.
KROV FM, the heart and soul of San Antonio. Grandmaster Flash and the Furious 5. That was happy birthday. I know you guys remember that. One little old school back for you. As I said today, our guest for our Saturday conversation is Sid Martinez, and he's from Connie Health. And I got to tell you, I think I know everything about everything. I found out how much I don't know about Medicare and Medicare Advantage. So how are you, Sid?
I'm doing great. Thanks for having me.
Absolutely, absolutely. Now, Sid, tell us a little bit about yourself, so the audience can get a kind of a feel of who you are.
Sure. I'm the general manager for Connie Health here in the San Antonio and Austin market. We help folks, our seniors in the community, with their Medicare benefits. We're just trying to reach out to the community. Let them know we're a local agency here in San Antonio. I've been doing this personally for over 10 years now,
okay,
helping folks in the community. And Connie Health is committed to doing the same thing.
Awesome, awesome, awesome. Well, thank you so much. I appreciate you being up. So this whole thing about Medicare and Medicare Advantage, there's all kinds of myths and things that go about. So can you just start by telling us the difference between the two? Just start from the very basics.
Sure. So Medicare is the federal insurance program for folks who are turning 65 or who are older who have been in the program. There's several parts to Medicare, which include Part A, which is your hospital coverage, Part B for medical, Part D, which is going to be for prescription coverage, and also a Part C, which is also known as Medicare Advantage. And again, different people have different options when it comes to Medicare benefits, whether they decide to stay on regular Medicare, or they can go the Medicare Advantage route or Medicare Supplement route as well.
Okay, so tell me what is Medicare Advantage?
So Medicare Advantage, also known as Part C, is going to provide folks with additional benefits that they get from regular Medicare, such as vision, dental benefits, transportation, gym memberships. It has usually a built-in prescription drug plan at no additional cost. And it really helps folks just kind of get more coverage than they get from traditional Medicare.
Okay. So, wow. Okay, so does it cost more?
Good question. Typically not, depending on the carrier and the plan. Just remember, you have to have Medicare Part A and Part B to qualify for Medicare Advantage plans.
Okay.
The premium for Part B this year is $148.50.
Right.
That's usually deducted through Social Security.
Right.
Yeah, or some people may get direct bill, but that's the premium. Most of the Medicare Advantage plans are not going to have any additional premium. What happens is, since folks are paying that premium on the Part B side, if they enroll in a Medicare Advantage plan, Medicare ends up sending that $148.50 that they deducted from the Social Security, and they send it to the carrier that they enrolled with.
Okay.
So typically, most plans are going to be zero premium.
Okay. Okay. And what are, I guess, I saw here today in preparing for this, there are over 260 some odd plans in Texas.
Wow, yeah, in Texas alone, yeah. In San Antonio and Austin market, it's not that much. You're looking at more around 50 plans that you can choose from.
Okay.
And I say that because there's probably about a good 10 to 12 carriers out there, but within those carriers, each carrier has maybe 6 to 8 plans that they offer. So that's why you see so many numerous plans available to you.
Okay. So now if I am a person qualifies for Medicare, and I choose an Advantage plan, am I bound to by geography for use of that plan?
Great question. Yeah. So the Medicare Advantage plans are going to be in the service area that they're offering. So for example, here in San Antonio, the county that you live in, those plans are going to offer benefits within that service area is what we call it. But if you're traveling in somewhere in the country, you still have coverage for emergency and urgent care.
Okay. Okay. All right. And that's due no matter who I have.
Exactly.
Okay. Cool. Okay. So now, tell me a little bit. Tell us about Connie Health. Does Connie Health offer plans?
Yeah. So Connie Health, we're unique. We're a local agency here in San Antonio, Austin markets. What we do, we use technology to help folks and help them find and make a recommendation for a plan. We get to know our clients one-on-one. We get to understand what their needs are, what kind of prescriptions they're taking. They have a preference for a primary doctor. We get all the information, understand what's important for their health care. We plug it into our proprietary software here, and those plans that we talked about, that there were so many of them, it basically narrows down the search based on their preferences, where we can make a good recommendation based on their individual needs.
Wow.
Yeah.
So do you guys provide actual plans?
So we are an agency, a broker, if you will. We are contracted with all the major health carriers in the area.
Okay.
And so we are able to offer all the plans that are being offered in the community.
Okay. And is there a cost?
So there's no cost when it comes to using our services whatsoever. Our consultations are 100% free. We don't charge. And there's never an obligation to enroll in any plan. What our goal is to educate our clients,
Mm-hmm.
let them know what their options are based on their individual needs, and if we're able to help them, fantastic. We would love to help them. And there may be situations where we're reviewing their benefits, and depending on their situation, they may already be on the best plan for them,
Mm-hmm.
and that's perfectly fine. Our goal is to make sure they are on the right plan.
Okay. Wow. That's and it's free. Nothing is free today. Come on now.
Our service is 100% free. Absolutely. We do get, if we do enroll somebody, we get compensation from the actual insurance company.
Okay.
But as far as for the client, there's no charge whatsoever.
Okay. So now, and how long have you been here in Texas, Connie Health?
Connie Health, we just expanded into the Texas market this year.
Mm-hmm.
Again, Connie Health is committed to serving the community. We're actually expanded in several markets in Texas, Illinois, and so we're new to Texas this year, but that doesn't, we offer the same type of service or an agency that's been around for a while.
Wow. So this is really fascinating. I've never, because normally, I've heard where, you'll get a call from Humana or from Blue Cross Blue Shield, and so they're representing just their plan. But
Absolutely.
So the advantage with Connie Health, if I understand this correctly, is that because you are a broker, you have access to all of those plans.
Absolutely. Great point. Absolutely. And unfortunately, during this time of the year, annual enrollment, folks are getting bombarded by phone calls left and right, by mail. But you're right. If a certain carrier calls in, they're only able to tell you about the plans that they carry. They're not really doing a thorough job of really saying based on your needs, what options are going to be available to you. So what we do with Connie Health, we're able to search all the plans at one time, get the information, find out what's important, who are your doctors, what medications are you taking, and we narrow down that search and make a solid recommendation based on your needs.
Wow. That is, now how long has Connie Health been around?
Connie Health was founded in 2019 by our three founding members, Odette Iran, Michael Scopa, and David Luna.
Okay, because I got to tell you, this sounds like something totally, like new, and I'm pleasantly surprised, especially in the healthcare industry. It seems like everything goes against the patient. And I'm trying to find a loophole here to find out where it is. Where does the patient get stabbed in the back or the consumer get? But you guys look like you have this thing covered really well.
Yeah, we're really unique. Our business model and how we help clients and in the communities that we serve. Again, we're local to the area.
Mm-hmm.
Number one, we have knowledgeable agents in the San Antonio and Austin market
Okay.
that understand the landscape of our community and what's important to our seniors and Medicare beneficiaries. So with all that being said, I don't know about you, Doug, but I like doing business with folks locally.
Absolutely.
And that's what Connie Health brings to the table.
Well, okay. So now, how many agents do you have?
We have right now about 10 agents currently in San Antonio.
Ooh.
Yeah.
There are a lot of old folks in San Antonio.
But I tell you what, this is the busy time of the year, and we're able to handle in-person appointments as well, but over the phone also.
Okay.
So we're not necessarily a big team, which is what we didn't want to do anyways. We wanted to have some quality agents on staff here.
Right.
But we have plenty of folks to help out, and we're available basically from 8 in the morning till late in the evening, just because we know this is annual enrollment, and that we need to be have feet on the ground, so to speak.
Okay. So now, tell me about the open enrollment period. What do you need to do to enroll?
Good question. So the annual enrollment is what we're in right
Annual
now.
enrollment, okay.
It's October 15th through December 7th.
Okay.
Okay. This is the time of the year, if you're a Medicare beneficiary, if you're on a current plan right now,
Mm-hmm.
and you want to compare what you have
Okay.
with what's out there. It's very important, and we strongly recommend that you do a plan comparison every year. You just want to ensure that you're getting the most out of your benefits.
Okay.
Because plans change, and we talked about this a little bit off air a minute ago. But plans change, and they can be taken away benefits. They may add some benefits here and there. there may be benefits that are brand new to the market, and it's very important to understand your options, because you may not be getting the most out of it. And Medicare, you definitely want to make sure you're getting the most out of your Medicare benefit. You earned it, so it's wise to do that comparison.
So now I get this book. They send me this book. It's like that thick, and it's paper.
The Medicare handbook.
And that's got all of these plans in it, right?
Oh yeah, oh yeah.
And I'm supposed to look through that and figure out which one of those I want to take.
Yeah, I trust me. I have that book. I carried it with me for a while. It's just too confusing. There's just too much information. It's not laid out in an easy to read type format.
No.
And folks try to do it. Don't get me wrong.
I've tried.
But like I said, we have some proprietary software that we use that we can show our clients and what we're looking at, and it makes it so simple to see the plans side by side and understand what is it that each plan has to offer. So, again, something unique to Connie Health.
Well, because I gotta, I'm just. So personally, this personal thing, I look at that thing every year, try to okay, I'm going to change, and I end up says, well, if you want to keep Medicare, don't do anything. So I end up not doing anything because it's just easier. So if you've got the software that can decipher all of that, and based on, the information that you put in there, that is an excellent tool.
Yeah, it's a game changer. I'm telling you, Doug. That's what's very unique to Connie Health. We built this from the ground up, knowing what we needed to be successful. And it's a great thing. It really helps us narrow down the search and really focus on what's important to the consumer or the client that we're speaking with. And again, it's based on your preferences. If you have a doctor you're seeing, especially on your medications, what medications are you taking? Are you more interested in dental benefits versus vision benefits? We take all into consideration. Pay really close attention to the needs of the client, and our tool just does that for us. It really makes it a lot easier. It makes my job easier. We're more efficient, and we can get customers the information they need to make an informed decision.
Now, you have proprietary software, so you guys are the only one with this software.
So Connie Health built their own software. Yeah, there's probably other programs out there, but ours is really, I've seen other programs out there, and ours is really unique in the sense that we were able to just kind of narrow down based on the client's needs. Yeah.
Wow, that is excellent. So now, and you got agents, so you do it by phone. We can do it in person. We come to your office. What's your typical mode of operation?
We can definitely do in-person appointments. We try to make this as convenient as possible for folks. We do also offer phone appointments as well as virtual, if that's your preference.
Okay.
But definitely, our model is to go out and get with you one-on-one.
Okay. And so now the other thing I noticed here, looking through here, I always start open enrollment for any kind of plan, like even for people who don't have Medicare, is like October 15th through December 7th, whatever. But then I look on here and I see that there are like 1, 2, 3, 4, 5, 6 other open enrollment periods. Can you tell me what the difference is?
Well, I think you're talking about, so we talked a little bit about annual enrollment, October 15th through December 7th. Okay. That's the main time where people who are already on Medicare plans compare. Okay. Next year they're going to have what's called open enrollment, not to get the two confused, which is going to be from January through March, and that's going to give folks another opportunity to compare plans. If they if they change their mind on the plan they enrolled in, they can go back to the plan they were originally on, or they can even just go back to traditional Medicare and select a prescription drug plan if that's what they wish. As far as other enrollment periods, people that are aging into Medicare, it's called your initial election period, which is typically 3 months before your 65th month birthday and 3 months after your 65th month birthday. So it's a 7-month window.
Okay.
And then there's also periods such as special election periods as well. And those pertain to folks if they qualify. Let's say you're on the Medicare Advantage plan already. Maybe you're not too happy with the plan itself, the benefits that you're getting. If you qualify for a special election, that's another opportunity where you can actually change your plan and elect another plan of your choice.
So now, okay. So under the special enrollment plan, what would you have to do to qualify for that?
So there's different things that trigger those special election periods. Let's say you move from one county to the next. Again, these plans are really based on the county you live in, the service area, if you will. So that may trigger a special election period. Let's say. One important thing here to note is there's a special election for people with chronic conditions, right? If you're diabetic, you have any kind of heart issues, if the carrier offers a plan that caters to those type of individuals with those chronic conditions, that will open up a special election period if the carrier offers what's called a chronic special needs plan as well.
Okay.
People on Medicaid, that's another good one too. There's a lot of folks on Medicaid here in Texas and
Yes.
San Antonio. They have the ability to not have to wait a whole year to switch plans. They can actually switch up to 3 times per year, once
Okay.
a quarter, except the final quarter of the year, to elect the plan of their choice if they don't feel that they're getting the best out of their
they
plan.
want. Okay,
Yeah.
okay. And while we were talking about enrollment periods, can you explain Medigap for me?
Sure. So Medigap is another option folks have. As they're aging into Medicare, that's just another route that you can take. Medigap, also known as Medicare Supplements, are offered through private insurance companies as well.
Okay.
They're actual insurance policies. They may or may not be medically underwritten depending on when you enroll.
Okay.
But they actually have a premium. There's different plans ranging from Plan A to Plan G.
Okay.
Plan G offering the broader coverage for the benefits. And essentially what they do is they will cover the 20% that Medicare.
So they're like an AFLAC kind of a thing.
Somewhat, yeah.
Okay.
So they cover that 20% co-insurance that you're responsible and the deductibles depending on the plan that you select. But Plan G being the broadest, that would cover. Just to make a note of it, there was a Plan F at one point that you can no longer get. That was actually the broadest coverage at some point. But if you have a Medicare Supplement Plan F now, you're actually grandfathered into it and you can keep it.
Okay.
Yeah.
Wow.
But I just want to mention also with the Medicare Supplements, they are an additional premium monthly. You do have to get a separate drug plan as well. So now you're looking at 3 premiums. You have your Medicare Part B premium, you have your Medigap premium, and then you also have a prescription drug premium. They come in, they work really well for folks who really want that flexibility and the ability to go see any doctor that they wish. But it doesn't come with all the bells and whistles that I mentioned, such as the dental, the vision, transportation, gym memberships, and any additional benefits that each plan offers.
So tell me about the gym memberships.
Yeah, absolutely. So most carriers nowadays are going to offer that.
Is it Silver Sneakers? Or?
Silver Sneakers is one of the vendors that is used.
Okay.
Not to get into all the names of it, but most plans are going to carry some form of a gym membership.
Okay.
You just got to find out what plans or what gyms participate with that carrier or that vendor. And essentially you get a basic free membership to go. And the idea is exercise. Everybody knows the more you exercise, the more healthy you can be. It's just a great benefit to have. And again, at no charge to you.
Wow.
Yep.
Well, you totally opened my eyes today. I am I'm just overwhelmed with just sitting here talking to you. So now, so if I want to use Connie Health, how do I do that?
Great job. You just need to give us a call.
Okay.
That number is 1-888-647-7330.
I'll make sure I post that.
What's that?
I'll make sure to post that.
Appreciate it. Yeah, you'll speak to one of our friendly reps, inside sales reps, and they'll answer any questions that you have, and we'll get you set up with an appointment.
Wow, okay. And so this, you guys, this is really, really, I mean, this has been so informative. Thank you so much for coming here because this is amazing. So now, you know what? We were talking offline about it, and I got several questions about when I told people you were coming on. Tell us a little bit about the prospects of Medicare for all.
Wow, yeah, that's a great question.
I know. I may have put you on the spot, but you're in the industry, so you hear things that the normal person doesn't hear.
Well, yeah, I mean it's definitely it's somewhat politicized, unfortunately. I think for me personally, I think it would be a great thing for most people here in this country to offer some form of medical coverage, which I think is very important. I don't think medical coverage is everybody needs it.
It's
right?
not a privilege.
It's not a privilege. That's what I was getting at. Absolutely, it's a right. I strongly believe that personally, but not to get too politicized about it. But I think it's up in the air right now. I don't know what's going to happen. We don't really know what. I know there's a lot of proponents for it, but we'll see. I think it would be a great thing either way.
I think the baby boomers have been the catalyst for a lot of change that we've seen, and with all of the people, there's some number I heard the other day that there's an incredible number of thousands, tens of thousands of people that turn like 65 every year.
The numbers, it's about 10,000 folks are turning 65 every day. Every single day.
That's crazy.
Yeah, and you can just imagine. So that just leaves a lot of room. People need help.
Right.
People need help, and that's what Connie Health is here to do. Just give them the information, educate them, find out what's important to them when it comes to their health care. And that's what we do. We really just want to help folks in our community. And again, at no charge to them, no obligation.
Wow.
And it's just a great thing. We really, I love what I do. All our agents love what we do. We love helping our seniors or anybody that's a Medicare beneficiary. And again, they can call us at 1-888-647-7330, and we'll be more than happy to help.
And that's in Austin or in San Antonio?
Austin and San Antonio, yes.
Same number. Okay, cool.
Yep.
Well, you know, Sid, you are the man. You are my new hero, because you just made stuff just a lot clearer to me, and hopefully for our audience as well. This is a fascinating topic, and it scares a lot of people. I know it scares me, so I mean, I'm just speaking of myself. It is, because you know, you're talking about your health and everything, and if you get it wrong, you're stuck with it for a year. So.
Yeah, and that's the typical situation. You're in that plan typically for a year.
Right.
Okay, and then that's why the annual enrollment is here, so that way you can, if you're not happy with your plan, you can compare and see what's out there for you. If you're happy with your plan, you don't need to do anything. Most of these plans are going to auto-renew anyways. But I strongly encourage for folks to at least do a plan review.
Okay.
At the very least, because, like I said, the plans change, the benefits change. You may be entitled to some benefits that you didn't even know that you were capable of getting.
And so the plan review,
important.
that's not something you would recommend a person do on their own, correct?
You can, but I don't. You wouldn't want a knowledgeable Medicare expert, if you will, to help you, research those plans for you. We have the tool. We narrow it down. Imagine going through that book that you just mentioned, the Medicare Annual Handbook. Good luck with that. I tell you what, you're having trouble sleeping at night, read that. Not a problem. You go to sleep.
And Connie Health, you represent all of the plans.
We're contracted with most major plans here in San Antonio. Yeah, and so there's about 8 to 10 plans we're contracted with, and within those plans,
there's multiple
options for you. So we feel real confident that more than likely we can help find a solution for you.
So, and to tell you everybody, you really ought to check them out, Connie Health. It's free to you, and it is a service I think that we all, if you're 65 or older and you already have Medicare, and this annual review thing, it is something that you have to do, and it's and that number is, once again, 888-647-7330. Wow, that was bad. 888-647-7330. You want to call that number, schedule your plan review, and hopefully you'll get the health care that you deserve, or at least you'll get the plan that best fits your circumstances. Would you agree?
Absolutely. We're here to help. Absolutely.
All right. Sid, it's been a great afternoon. Thank you so much for your conversation. Thanks so much for the wealth of knowledge. I really appreciate you. And anytime something's coming up, please, you're welcome here all the time on the Dr. Doug Saturday Show.
Thank you so much. Really appreciate the time. Thank you.
That's Sid Martinez from Connie Health. Something you really got to check into. And I'll have all the numbers and everything on our Facebook page, so you'll be able to look them up there. KROV FM, the heart and soul of San Antonio. The Dr. Doug Saturday Insight Show will be back shortly.
That was fun.
That was. Bye, everyone. You did extremely well. You must do this a lot.
A little nervous.
No, you weren't nervous at all. You did outstanding. That was perfect.
Thank you.
I said, wow, this guy, he's prepared.